So let's talk about immune dysfunction. Immune dysfunction means anytime your immune system is out of balance or is stuck in a certain arena. So if we have autoimmune disease activation, chronic fatigue, that's going to be a huge source of chronic fatigue, or chronic gut dysfunction. We've also seen this with endometriosis. But basically, the immune system has gone awry and it is stuck doing something that we don't want it to be stuck doing. And so with that autoimmune activation, we can see a lot of it come when the body is overburdened. I love the analogy of your body can adapt until you fill up that cup with the stressors of life, and then the cup spills over, right? Your body just can't quite adapt anymore. That's when we see a lot of time this immune dysfunction happen. And we've seen a lot of it post-COVID. We see a lot of it postpartum. Again, that's the body has been stressed out to the max and it can't adapt anymore. So that's when the genetics start to get activated. We start to see chronic infections like Epstein-Barr, Lyme, mycotoxins, herpes viruses reactivate and rear their heads. And these can be significant sources of chronic fatigue and for just not feeling your best, right? Having fibromyalgia, just feeling achy everywhere, a throbbing body, brain fog, disrupted sleep. We've even seen this trigger anxiety, depression. This can create that disrupted immune system, and it's systemic. So you can be having mast cells activating all over your body, and it really affects how you feel. So when we look at immune dysfunction, we want to see, what genetics are at play, and we want to see if we can we can't change your genetics, but we can change the expression through the treatment of epigenetics. We also want to look at if there are any stressors that are triggering the immune dysfunction, chronic infections, environmental toxins, sex hormone disruptions, what's happening in the gut. And so there are certain therapeutics that we can use directly to modulate the immune response. Are we going to try and push it into a certain Th1 versus Th2 or Th3 response, while we do supportive work to address the root cause, to bring the system into balance so that your immune system isn't as triggered anymore. It's in more of a flexible state and it's not in this rigid state. That flexibility is really key for your immune system because it allows your immune system to adapt to cold, viruses, bacteria, inflammation as needed, but we don't want it to stay there. And so bringing in this immune flexibility is what helps to keep that immune system in check so that you can get back to thriving and living the life that you want to live.